As we age, our bodies undergo significant changes that affect how we process and respond to different foods. While fruits are universally celebrated as nutritious powerhouses packed with vitamins, minerals, antioxidants, and fiber, certain fruits can pose unique challenges for seniors. This comprehensive guide explores 7 fruits that older adults should consume with particular caution, not because they're inherently bad, but because they may interact with medications, exacerbate existing health conditions, or present digestive challenges that are more pronounced in the senior population. Understanding these potential concerns doesn't mean eliminating these fruits entirely from your diet. Instead, it means making informed decisions about portion sizes, frequency of consumption, and timing, while always consulting with healthcare providers about individual dietary needs and restrictions. The changing nutritional landscape after 65. Metabolic changes in seniors. The aging process brings about numerous physiological changes that directly impact how our bodies handle different foods. Metabolism naturally slows down, typically decreasing by 1 to 2% per year after age 30, with more pronounced changes after 65. This metabolic slowdown affects how quickly the body processes sugars, making blood glucose management more challenging for many seniors. Additionally, kidney function gradually declines with age, affecting the body's ability to filter and excrete certain compounds. The liver's capacity to metabolize various substances also diminishes, potentially leading to stronger or longer-lasting effects from both medications and food compounds. These changes create a delicate balance where foods that were once perfectly fine may now require more careful consideration. Medication interactions, a growing concern. Perhaps one of the most critical factors for seniors to consider is the potential for food-drug interactions. According to recent studies, adults over 65 take an average of 4 to 5 prescription medications daily, with many taking even more. Certain fruits contain compounds that can significantly alter how medications are absorbed, metabolized, or eliminated from body. The cytochrome P450 enzyme system, which processes many medications in the liver, can be influenced by various fruit compounds. Some fruits can inhibit these enzymes, causing medications to remain in the system longer and potentially reach toxic levels. Others may accelerate drug metabolism, reducing medication effectiveness. This complex interplay makes it essential for seniors to be aware of potential interactions between their medications and the fruits they consume. Fruit number 1. Grapefruit, the medication interaction champion. The science behind grapefruit's effects. Grapefruit stands out as perhaps the most problematic fruit for seniors, primarily due to its powerful interaction with medications. The culprit is a group of compounds called furanocoumarins, particularly bergamottin and dihydroxybergamotin, which are concentrated in the fruit's white pith and juice. These compounds are potent inhibitors of CYP3A4, a crucial enzyme in the cytochrome P450 system that metabolizes approximately 50% of all prescription medications. When this enzyme is inhibited, medications can accumulate to dangerous levels in the bloodstream, potentially causing severe side effects or toxicity. Medications affected by grapefruit. The list of medications that interact with grapefruit is extensive and includes many commonly prescribed drugs for seniors. Cardiovascular medications, statins, atorvastatin, simvastatin, levastatin, used to lower cholesterol, can reach toxic levels when combined with grapefruit, potentially causing severe muscle damage or kidney problems. Calcium channel blockers used for blood pressure and heart conditions can cause dangerous drops in blood pressure when grapefruit inhibits their metabolism. Psychiatric medications. Benzodiazepines like diazepam and alprazolam can have enhanced sedative effects, increasing fall risk and cognitive impairment. Certain antidepressants may also be affected, potentially leading to increased side effects. Immune system suppressants. Medications like cyclosporin, used after organ transplants or for autoimmune conditions, can reach toxic levels with grapefruit consumption, potentially causing serious organ damage. Pain medications. Some opioid pain relievers may have enhanced effects, increasing the risk of respiratory depression and other serious complications. The persistence problem. What makes grapefruit particularly concerning is the duration of its effects. Unlike many food-drug interactions that are relatively short-lived, grapefruit's enzyme inhibition can persist for 24 to 72 hours after consumption. This means that even spacing grapefruit consumption away from medication times may not eliminate the risk of interaction. Safer alternatives for citrus lovers. For seniors who enjoy citrus fruits, oranges, tangerines, lemons, and limes are generally safer alternatives. These fruits don't contain the problematic furanocoumarins found in grapefruit and provide similar vitamin C and citrus flavonoids without the medication interaction risks. Fruit number 2, pomegranate, the antioxidant powerhouse with hidden risks. Understanding pomegranate's potent compounds. Pomegranates have gained tremendous popularity in recent years due to their exceptional antioxidant content, particularly punicalagins and ellagic acid. While these compounds offer impressive health benefits, including anti-inflammatory and heart protective effects, they can also present challenges for seniors. Blood pressure and medication interactions. Pomegranate juice has been shown to have significant blood pressure lowering effects, which can be beneficial for many people. However, for seniors already taking blood pressure medications, this additional effect can cause blood pressure to drop to dangerously low levels, leading to dizziness, falls, and fainting episodes. The fruit contains compounds that may also interact with blood thinners like warfarin. Some studies suggest that pomegranate can enhance the effects of anticoagulant medications, potentially increasing bleeding risk. For seniors who are already at higher risk for falls and injuries, this increased bleeding tendency can be particularly concerning. Blood sugar considerations. While pomegranate has a moderate glycemic index, its concentrated sugars can still cause blood sugar spikes in seniors with diabetes or prediabetes. A single cup of pomegranate seeds contains approximately 24 grams of sugar, which may be more than some seniors can handle without affecting their blood glucose control. Kidney stone risk. Pomegranates are relatively high in oxalates, compounds that can contribute to kidney stone formation. Seniors often have decreased kidney function and may be at higher risk for kidney stones. Regular consumption of high oxalate foods like pomegranates may increase this risk, particularly in individuals with a history of calcium oxalate kidney stones. Digestive concerns. The seeds and membranes of pomegranates contain tannins, which can be astringent and may cause digestive discomfort in some seniors. These compounds can also interfere with iron absorption, which may be concerning for seniors already at risk for iron deficiency. Digestive concerns. The seeds and membranes of pomegranates contain tannins, which can be astringent and may cause digestive discomfort in some seniors. These compounds can also interfere with iron absorption, which may be concerning for seniors already at risk for iron deficiency. Fruit number 3, star fruit, carambola, the neurotoxic beauty. The hidden danger in a pretty package. Star fruit, with its attractive star-shaped cross-section and sweet tart flavor, might seem like a harmless tropical treat. However, this fruit contains a powerful neurotoxin called caramboxin that can be extremely dangerous for seniors, particularly those with any degree of kidney impairment. Neurotoxicity and kidney function. Healthy kidneys can filter out caramboxin effectively, but even mild kidney dysfunction can lead to the accumulation of this neurotoxin. Since kidney function naturally declines with age, many seniors may have reduced kidney capacity without even being aware of it. When caramboxin accumulates, it can cause serious neurological symptoms, including confusion, seizures, and even coma. Symptoms of star fruit poisoning. Star fruit toxicity can manifest in various ways, ranging from mild to severe. Early symptoms may include hiccups, vomiting, and confusion. As toxicity progresses, symptoms can escalate to include muscle weakness, numbness, seizures, and loss of consciousness. In severe cases, star fruit poisoning can be fatal, particularly in individuals with compromised kidney function. Medication interactions. Star fruit may also interact with certain medications by affecting their absorption and metabolism. Some studies suggest that compounds in star fruit can influence the same enzyme systems affected by grapefruit, though to a lesser degree. Safe consumption guidelines. For seniors with normal kidney function, occasional small amounts of star fruit may be acceptable, but it's generally recommended to avoid this fruit altogether if there's any history of kidney problems, diabetes, or if kidney function hasn't been recently assessed. The risk simply outweighs the nutritional benefits when safer alternatives are readily available. Fruit number 4. Cranberries, the UTI fighter with complications. The double-edged sword of cranberry consumption. Cranberries have long been touted for their ability to prevent urinary tract infections, UTIs, making them particularly appealing to senior women who may be prone to recurrent UTIs. However, regular cranberry consumption can present several challenges for older adults. Blood thinner interactions. One of the most significant concerns with cranberries is their potential interaction with warfarin, a commonly prescribed blood thinner for seniors with atrial fibrillation or other cardiovascular conditions. Cranberries contain compounds that may enhance warfarin's effects, potentially leading to dangerous bleeding episodes. Several case reports have documented serious bleeding complications in patients taking warfarin who regularly consumed cranberry products. The interaction appears to be dose-dependent, meaning that larger amounts of cranberry products may pose greater risks. High oxalate content. Cranberries are among the highest oxalate-containing fruits, which can contribute to kidney stone formation. For seniors with a history of kidney stones or compromised kidney function, regular cranberry consumption may increase the risk of stone recurrence. Blood sugar and acidity concerns. Most commercially available cranberry products are heavily sweetened due to the fruit's naturally tart flavor. This added sugar can be problematic for seniors managing diabetes or prediabetes. Even unsweetened cranberry juice is quite acidic, which may exacerbate gastroesophageal reflux disease, GERD, or stomach ulcers, conditions that are more common in older adults. Digestive issues. The high fiber content and natural acids in cranberries can cause digestive upset in some seniors, particularly those with sensitive stomachs or inflammatory bowel conditions. Large amounts may lead to diarrhea, stomach cramping, and nausea. Safer approaches to UTI prevention. For seniors interested in UTI prevention, discussing alternative approaches with healthcare providers may be more appropriate. These might include proper hydration, good hygiene practices, and if necessary, low-dose antibiotics or other medical interventions that don't carry the same interaction risks as cranberry products. Fruit number 5. Elderberries, the immune system stimulant. The rise of elderberry supplements. Elderberries have gained significant popularity, particularly as immune system boosters and cold/flu remedies. Many seniors turn to elderberry supplements or syrups, hoping to strengthen their immune systems. But this approach may not always be beneficial. Immune system overstimulation. While a robust immune response is generally desirable, elderly individuals may have compromised or overactive immune systems that don't respond predictably to immune stimulants. Elderberries contain compounds that can significantly boost immune activity, but in some seniors, this may lead to excessive inflammation or worsen autoimmune conditions. Autoimmune concerns. For seniors with autoimmune conditions such as rheumatoid arthritis, lupus, or multiple sclerosis, elderberries' immune-stimulating properties could potentially worsen their condition by further activating an already overactive immune system. Blood sugar effects. Many elderberry products are high in sugar, either naturally or from added sweeteners. The concentrated nature of elderberry syrups and supplements can cause blood sugar spikes in diabetic seniors. Medication interactions. Elderberries may interact with certain medications, including immunosuppressive drugs and diabetes medications. The fruit's compounds can affect how these medications work, potentially reducing their effectiveness or causing unexpected side effects. Raw elderberry toxicity. It's important to note that raw elderberries, particularly the bark, seeds, and leaves, contain cyanogenic glycosides that can be toxic. While commercial elderberry products are typically made from cooked berries, Seniors should never consume raw elderberries or attempt to make their own preparations without proper knowledge. Fruit number 6. Mangoes, the tropical sugar bomb. The sweet temptation. Mangoes are beloved for their sweet, tropical flavor and creamy texture. However, their high sugar content and several other factors make them problematic for many seniors. Blood sugar impact. A single medium mango contains approximately 46 grams of sugar, which is more than many seniors with diabetes or pre-diabetes can handle without significant blood glucose spikes. Even for seniors without diabetes, this sugar load can contribute to energy crashes and may promote inflammation. Urushiol content. Mangoes belong to the same plant family as poison ivy and contain urushiol, the same compound that causes poison ivy reactions. While most of this compound is concentrated in the sap, leaves, and bark of the mango tree, some can be present on the fruit's skin. Seniors with sensitive skin or known allergies to poison ivy may experience contact dermatitis from handling mangoes. High caloric density. Mangoes are relatively high in calories, with a medium fruit containing about 200 calories. For seniors who may be less active and need fewer calories, regular mango consumption can contribute to unwanted weight gain. Digestive issues. The high fiber content in mangoes, while generally beneficial, can cause digestive upset in seniors with sensitive stomachs. The natural sugars in mangoes can also ferment in the gut, potentially causing gas, bloating, and diarrhea in some individuals. Medication absorption. Some compounds in mangoes may affect the absorption of certain medications, though this interaction is not as well documented as with other fruits on this list. However, the high fiber content may slow the absorption of some medications if consumed at the same time. Fruit number 7. Grapes, the resveratrol paradox. The benefits and drawbacks of nature's candy. Grapes are often celebrated for their resveratrol content, particularly in red varieties, which offers antioxidant and heart protective benefits. However, several factors make grapes potentially problematic for seniors. High sugar content and blood glucose. Grapes are among the highest sugar-containing fruits, with about 16 grams of sugar per cup. This natural sugar is primarily glucose and fructose, which can cause rapid blood sugar spikes. For seniors managing diabetes or pre-diabetes, grapes can be particularly challenging to incorporate into a balanced meal plan. Concentrated calories. Grapes are easy to overeat due to their small size and sweet taste. A cup of grapes contains about 140 calories, and it's easy to consume multiple cups without realizing it. This can contribute to weight gain, which is associated with numerous health problems in seniors. Pesticide residue concerns. Grapes consistently rank high on the Dirty Dozen list of fruits and vegetables with the highest pesticide residues. Seniors may be more susceptible to the effects of pesticide exposure due to decreased detoxification capacity and potential medication interactions. Blood thinner interactions. While the evidence is not as strong as with cranberries, some studies suggest that compounds in grapes, particularly resveratrol, may have mild blood-thinning effects. For seniors taking anticoagulant medications, this could potentially increase bleeding risk. Kidney stone risk. Grapes contain moderate amounts of oxalates, which may contribute to kidney stone formation in susceptible individuals. Combined with their high sugar content, this makes grapes a concern for seniors with kidney problems. Choking hazard. While this may seem minor, whole grapes can pose a choking hazard, particularly for seniors with swallowing difficulties or dental problems. The smooth, round shape of grapes can make them difficult to chew properly, increasing aspiration risk. Understanding individual risk factors. The importance of personalized nutrition. It's crucial to understand that the risks associated with these fruits are not universal. Individual factors play a significant role in determining whether a particular fruit may be problematic. These factors include current medications, existing health conditions, kidney and liver function, and individual tolerance levels. Medication review. The single most important step seniors can take is to review their medications with their healthcare provider or pharmacist to identify potential food-drug interactions. This review should include not only prescription medications, but also over-the-counter drugs and supplements. Health condition considerations. Specific health conditions may make certain fruits more problematic. For example, seniors with chronic kidney disease should be particularly cautious about fruits high in potassium and oxalates. Those with diabetes need to carefully monitor fruits with high sugar content. Individuals with autoimmune conditions should be wary of immune-stimulating fruits like elderberries. Regular health monitoring. Regular health checkups, including kidney function tests, liver function panels, and blood sugar monitoring, can help seniors and their healthcare providers make informed decisions about dietary choices. Safe consumption strategies. Portion control and timing. When seniors do choose to consume any of these potentially problematic fruits, portion control becomes crucial. Small amounts consumed occasionally may be acceptable for some individuals, while others may need to avoid certain fruits entirely. Timing can also be important. Consuming fruits with meals can help slow sugar absorption and may reduce some medication interactions. However, this strategy should always be discussed with healthcare providers. Alternative preparation methods. Some of the risks associated with certain fruits can be minimized through different preparation methods. For example, cooking cranberries may reduce some of their oxalate content, while choosing organic grapes can minimize pesticide exposure. Safer fruit alternatives. Fortunately, many delicious and nutritious fruits are generally safer for seniors. Berries, strawberries, blueberries, blackberries are lower in sugar and high in antioxidants. Apples and pears provide fiber and nutrients with moderate sugar content. Citrus fruits, other than grapefruit, offer vitamin C and flavonoids with fewer interaction risks. The role of healthcare providers. Collaborative care. The decision about which fruits to include or avoid should always be made in collaboration with healthcare providers. Doctors, pharmacists, and registered dietitians can provide personalized guidance based on individual health status and medication regimens. Regular monitoring. For seniors who choose to continue consuming any of these fruits, regular monitoring may be necessary. This might include more frequent blood work to check medication levels, kidney function, or blood sugar control. Education and communication. Healthcare providers should educate seniors about potential food-drug interactions and encourage open communication about dietary habits and any new symptoms or side effects. Nutritional alternatives and balanced eating. Meeting nutritional needs. While avoiding certain fruits may seem limiting, seniors can still meet their nutritional needs through other food choices. The key is focusing on a varied diet that includes safer fruits, vegetables, whole grains, lean proteins, and healthy fats. Supplementation considerations. In some cases, supplements may be necessary to replace nutrients that would have been obtained from avoided fruits. For example, if a senior needs to avoid citrus fruits due to medication interactions, vitamin C supplementation might be recommended. Working with dietitians. Registered dietitians can help seniors develop meal plans that meet their nutritional needs while avoiding problematic foods. They can also provide guidance on reading food labels and identifying hidden sources of concerning compounds. Long-term health implications. Prevention focus. The goal of avoiding certain fruits is not to eliminate enjoyment from eating, but to prevent serious health complications. The potential consequences of food-drug interactions or worsening of existing health conditions far outweigh the temporary pleasure of consuming specific fruits. Quality of life considerations. Maintaining independence and quality of life should be primary goals for seniors. Making informed dietary choices that reduce the risk of hospitalizations, medication adjustments, or serious complications supports these goals. Family education. Family members and caregivers should also be educated about these potential risks so they can support seniors in making safe dietary choices and recognize warning signs of problems. Emergency preparedness. Recognizing warning signs. Seniors and their families should be aware of the warning signs that might indicate a food-drug interaction or fruit-related toxicity. These can include unusual drowsiness or confusion, changes in heart rate or blood pressure, digestive upset, or any new symptoms that develop after consuming certain fruits. When to seek help. Any concerning symptoms should be evaluated promptly by healthcare providers. For serious symptoms like difficulty breathing, chest pain, severe confusion, or loss of consciousness, emergency medical care should be sought immediately. Documentation. Keeping a food diary can be helpful in identifying potential problems and communicating with healthcare providers about dietary patterns and any associated symptoms. Conclusion. Making informed choices. The relationship between fruits and senior health is complex and highly individualized. While the 7 fruits discussed in this guide can pose risks for many seniors, this doesn't mean they should be universally avoided by all older adults. Instead, the key is making informed decisions based on individual health status, medication regimens, and risk factors. The goal is not to create fear around eating fruits, but to promote awareness and encourage seniors to work closely with their healthcare providers to make the best dietary choices for their specific situations. Many seniors may be able to consume some of these fruits in small amounts or with certain precautions, while others may need to avoid them entirely. What matters most is that seniors have the information they need to make these decisions safely. A diet rich in appropriate fruits and vegetables remains one of the most important factors in maintaining health and independence as we age. By understanding the potential risks and working with healthcare providers to develop personalized dietary strategies, seniors can continue to enjoy nutritious, varied diets while minimizing health risks. Remember, this information should never replace professional medical advice. Always consult with healthcare providers before making significant changes to your diet, especially if you take medications or have chronic health conditions. Your healthcare team can provide personalized guidance that takes into account your unique health situation and helps you make the safest choices for your individual needs. The journey of healthy aging involves many decisions, and dietary choices are among the most important. By staying informed, working with healthcare providers, and making thoughtful choices about food consumption, seniors can continue to enjoy eating while supporting their health and well-being throughout their golden years.